opioid epidemic and the important conversations that surround it have found a new platform during ABC's Tuesday night primetime lineup, specifically during the season premiere of The Conners, a reboot of Roseanne, noticeably without his titular character, following controversial tweets from Roseanne Barr earlier this year. When the show was announced, there was a lot of curiosity as to how the lead character would be written off the show. And last night, the viewers found out Roseanne overdosed on prescription pain meds following a knee surgery.
Must have taken the pills right before bed, and with her health issues, it was enough to stop her breathing.
Wait, what? Mom overdosed?
It doesn't make any sense.
The plot development injected the national epidemic into the sitcom's narrative. Some viewers, including Roseanne Barr, were upset by the choice, but others said they were moved by the show's portrayal of a family in grief, saying that anyone, anywhere, whose life has been impacted by opiate use could identify. That includes people right here in our community. There's a sobering statistic in Spokane. Between 2013 and 2017, almost 200 people died from opioid overdoses. Now the County Regional Health District has formed a task force to address the problem, made up of community leaders from all corners of the region. Our Hockhammer working for you on that story.
Here's the message straight up from someone who knows. The stigma needs to be dispelled.
Substance use disorders is not prejudice. It doesn't care where you come from, what color your skin is, how much money you make, or how educated or not you are. And so it can affect any of us.
Dawn Fleece sees dozens of kids working to overcome their opioid addiction each day at Daybreak Youth Services. It can be tragic but rewarding work because as an organization, they're on the forefront making a difference. They are a part of the new opioid task force. They know all too well what the drugs can do.
It's ruining their relationships, their health, schools, their schoolwork, more dropping out of school because they're not making it to school.
Then it can lead to criminal activity. She says with kids, she sees mostly prescription drug abuse.
Because adolescents, they don't think that that's a problem because it's prescribed. And what they don't realize is how dangerous it is.
But it's not just the pills, especially in the older folk.
Illicit drugs, IV drug usage like heroin. We are starting to see fentanyl.
Across the board, though, for at least the prescribed medications, Lutz says the task force is going to be focused on educating people on how to approach loved ones that might be addicted and switching up how providers think of pain management.
I think, unfortunately, not only have providers become very comfortable with using opioids, but patients have come to expect that.
They'll also be sponsoring medication take-back events, and they'll be working to educate folks on what else is out there to help those hurting.
Such as exercise, such as yoga, such as physical therapy, acupuncture.